Guys, how exciting is this? We have the Floreanis here. Let's give them a big round of applause. That's awesome. Very cool. Well, I'm really excited you guys are all here. I know they are too. I'm really excited that they're here. They're all the way from Australia. If you didn't know that, they just got off a 16-hour flight. So really just bring the energy tonight. We're really excited. Dr. Jennifer, she is a known speaker and she's a world-renowned best-selling author, Well-Adjusted Babies. I'm sure you all know about it now, and a couple others. So she is a wellness expert, all about kiddos and family, and so we're really excited to have her. And then Dr. Simon, I know he is a kind of the thinker in the industry, and he's worked really hard the last 15 years to break down barriers, those institutional and cultural barriers for the health professionals in Australia. So hopefully he'll give you a little information about that. But join me in welcoming one more time, a big welcome, Texas welcome, for Dr. Simon and Dr. Jen Floreani. Yes, so you're being recorded too.
All right, great.
You can hook onto it.
All right, I'll hook that on, and then no doubt very soon Jennifer will take it off me, and then you'll get the real show. So thank you so much for having us. It seems like only yesterday that we were both students ourselves, and I think you'll find it very, very interesting how quickly life will go. Can I just get an idea of how many of you, who are early in the course, and who are the first trimesters we call it? 10 trimesters. So who's in the first 3? And then the second 3? And the third, fourth, third, fourth. Anyway, yeah. Okay, the last bit. Okay.
Heard us speak before?
Yeah, has anyone? Okay, great. Well, when we first started in practice, it was more common that you would aim to see someone a couple of times, maybe 5 or 6 times, and if you were any good, you might then be able to get a patient to come in for wellness once a month. But we had this internal conflict within us in that we both got adjusted every week. And so we were like, well, what do we do going into practice as 2 young graduates who love to get adjusted every week, and yet it was more normal that people would be seen 5 or 6 times, and then maybe, if you were good enough, you would convince them to come in a few times a year, possibly monthly if you were pretty good. So I don't know what the climate is like here in the US, but in Australia, that was the norm. And so when we set out to say, well, hang on, we need to set up a practice that's based on giving what it is that we would do for ourselves. And so we started offering clients in the community and their families to get checked every week. And that was like, whoa, really, really not the done thing. But we were flooded with referrals, because once you start getting adjusted regularly, and your nervous system turns on, and your immune system improves, and your life improves, you want more of that. It's like exercise. Those of us that know what it's like, you exercise once a month, and you're sort of not really doing anything. You exercise once a week, and you're getting a bit toned, a little bit of benefit, and you feel better for it. But when you exercise every second day, you know you're getting fit, and your body's becoming more and more alive. So chiropractic is a lot like that. One of the other things that the crazy pair that we are, that we're these university students who set up to this new style of family practice, is that we also believe that chiropractic should be offered as first choice. And again, that was in a time when you're lucky if people even knew what a chiropractic was, or this chiropractic thing that people used to talk about. So in the course of the 20 years I've been in practice, I've been fortunate enough to also get involved at a political level and leadership within the chiropractic boards. We have one main institution, one main representative institution called the Chiropractors Association, whereas here you've got the ACA, they've got all these different types of associations. This is now the second biggest chiropractic organisation after the ACA in the world. So the Chiropractic Association of Australia, and there's only 4,000 chiropractors in Australia. But we set out to make sure that chiropractic was of first choice for all Australians. And what's happened in my 20 years of practice is that now the second most utilised profession after the MD physician is the chiropractor. 1 in 4 Australians see chiropractors. And it's been a big struggle And even as much as this year, we've had an enormous smearing campaign going on because chiropractic is taking the turf. And there's been a 30% drop in physician visits and a 30% drop in Australia in surgery. So be careful what you wish for. And I hope that if there's one thing you get from us tonight, is that if you are daring enough to take the risk of setting a big vision, it will come true. And we deal with this thing. I watched, I'm going to hand it over in just a sec, but on the plane trip on the way over here, I watched Kung Fu Panda 3 with my 8-year-old, right? And they talk about this thing called innate intelligence, or Qi. And they talk about intent, and they talk about purpose. I'm sitting there going, oh my God, it's like the chiropractic story. And talk about healing through intent and through thoughtfulness and through collecting innate universal intelligence and bringing it through to offer it to people or plants or places or time. And you have that in your hands. You are uniquely trained with this thing called Qi, or this thing called universal intelligence, and if you only get your educated brain out of the way, then you'll be a conduit for that magnificence. We're going to tell you a few stories tonight of how simple people do simple things with these babies, and miracles will happen under your fingertips, because I know that's happened under mine. And if there's something we can give to you tonight, it'll be the confidence to maybe just try that on.
So what we'll do is we'll talk for a while, and then we're really happy to demonstrate technique for pregnant women or what we might do with babies and children. So we can do that from about halfway through. But if I can just also get a show of hands of those of you who grew up in a chiro family. Okay, great. And then those of you who experienced or had great experiences with chiropractic for a decent period of time before you started studying? Yep. Okay, wonderful. So the reason I ask that is just to get a gauge, because sometimes as students, if I think about some of my dearest friends when I was at university, I was actually shocked as to how they'd found themselves in the course. So I grew up as a chiropractic baby in a large chiropractic family, adjusted since the day I was born by my dad, who's a chiropractor. And every gift, every blessing in my life, I really do attribute to our profession. And so some of the wonderful friends that I created during university didn't have that experience as a child, and some of them ended up studying chiropractic because they didn't get into medicine. And what I know through, getting to know large numbers of chiropractors all over the world is that how you got here is not really the making of you. Because some of the most passionate and most successful chiropractors I know got into chiropractic because they didn't get into medicine. So I just want you to start off tonight realizing that whatever your story is, whether you're comparing yourself to somebody else in the room, just let it go. Because what is really the disservice that we as professionals do, you guys as students perhaps, is to just consider ourselves second-rate. You might consider yourself second-rate to your peers. We might do the same. Our profession tends to feel second-rate to medicine or to other health professions. And one of the things that we really want you to leave here with tonight, or this afternoon tonight by the time we finish up, is that it's our experience that there has never been a better time for chiropractic to thrive than right now. And I want to talk a bit more about why that is. And it's not because we can get here and be all excited and passionate. It's not about that anymore. Too many of our children are fat, they're sick, they're labelled, and they are struggling to relate to their world in every way, shape and form. And that's across the board. So 1 in 2 children have allergies, 1 in 4 asthma, 1 in 6 has a neurodevelopmental delay or a neurodevelopmental issue. 1 in 3 has obesity, 1 in 10 diabetes, 1 in 20 ADD, 1 in 38, that's the latest figure, from the CDC has autism. So what we want to talk to you about is how do we increase our reach? How do we let people know what it is that we offer? Because what we offer as a profession is so unique and it is so remarkable. And if more parents just knew what it is that we offered in helping to connect the mind and the body with this amazing healing capacity that we all have, then more and more children thrive, and that's what creates the demand. So often what happens is, as students, we might think, yeah, I want to go ahead and do more training in pediatrics. Can I have a show of hands of anyone who's thinking they want to specialise in peds? Yeah, great. And can I just say, learn everything that you can while you're a student, learn every technique that you can so that you have an amazing toolbox, because all of the clients that you will serve have unique needs. And rather than, in our experience, then solely doing one technique, which for a lot of chiropractors works really well, it's been our experience that it's useful to know other techniques because sometimes people don't respond to just one technique. And for us, we've trained probably, I think, about 22 associates in the last 15 years. And that's something that we encourage them to do because it's not about us. It's about the community that we serve. And the more skill and experience that we have, the greater reach we can have. So the reason I asked about those of you who are wanting to move towards pediatrics is that learn everything that you can here. When you finish here, do lots of different seminars. But please don't mistake that you have to have a number of extra post-nominals in pediatrics to look after children, because that's crap. Sorry, that's an Australian phrase, perhaps. Because I'm really tired of some people in our profession who use those expertise in pediatrics to intimidate others. There is such demand for what we offer these days, and I can tell you there are phenomenal chiropractors out there who may not have a zillion extra post-nominals, and they offer incredible service to babies and children and families. Is anyone challenged by that? Because I'm happy to explain it further. I'm not meaning to be offensive. I just want you to know that what you learn here and what you'll learn when you graduate from all the different seminars equips you so well. And we are enough right now, all of us, with the skill set that we have and that you will have when you finish, to help more and more families and children experience the chiropractic lifestyle. So we're going to talk about that more.
Okay, so one of the ways you'll know you'll get something from tonight is if you commit to keeping your mind open and then making some decisions about what you're going to do about it. So one of the tips I could give you as a student is to always remain open, not just when you're a student, and always keep learning and building your skill set. And whenever I go to a conference, I usually draw this line down the right-hand side, make a right-hand margin, and I make my to-do list. Because you'll come away from this going, oh, that was really nice. God, that lady's hot. That's what I think, anyway. It's really important you have some to-do lists so that when you leave, you go, I'm going to follow that up. I'm going to read that. I'm going to chase that study. I'm going to chase them down. I'm going to friend them on Facebook or whatever you're going to do to try and build your own confidence and esteem. So that's my suggestion for you. So on the other side, I write down all my take-home points that I might want to reflect on. And there's some things we'll cover off tonight so that you know for sure we've covered off some of these things. I tell you, when I first graduated, I was 21. And I looked like I was 15. So I wore this tie in the office so that I looked more mature. And people would say, gee, you look really young. How old are you? And I would say, how old do you think I am? And they go, oh, you must be about 30. And I go, something like that, you know? Because I was too embarrassed about who I was and what I was bringing to the consultation. And thankfully for me, I'm naive. Because I borrowed the collective confidence of all the chiropractors that I met in my time, and I would hope that you borrow our confidence to say, Oh, chiropractic? Yeah, that's seen plenty of kids with colic. I've never laid my hands on one, but yeah, chiropractic's great with colic. Chiropractic, Simon and Jennifer said it was great for, whatever condition that comes your way. You go, yep, we can work with that. We, the collective we, have worked with that and always have. There's chiropractors around the world that still Facebook message me because you're in touch with something much greater than you when you're a chiropractor. You're in touch with this universal intelligence that we all can use to help each other. Every single day on social media, someone contacts me and I log in and go, oh, have you thought of this? I've got 20 years of touching spines that you guys may not have. So why wouldn't you borrow that? That's the type of people we are. We're healers. I was 21 and I helped this lady when I was first in practice with dizziness. I adjusted her upper cervical and she didn't have to have this deep drilling into her inner ear. And to this surgeon's credit, he called me and he said, I don't know what you're doing. I don't know what you've done, but I need to know more about it. And so he took me, an ear, nose and throat surgeon, top surgeon, took me out to lunch. And I took the x-rays, dressed up, tried to look a bit older. And anyway, explained the nervous system and how I adjusted this and the relationship between there and how the dizziness might be related to that. And he said, after my big, fantastic explanation of everything, he said, look, I just think you've got a special gift. And I was like, what? He said, look, ear problems come from the ear, neck problems come from the neck. And I was like, yeah, but we know neurology and distance between cause and effect, switch nervous system on. And he's like, you just got a special gift. So he proceeded to send me 2 to 5 new patients every week that would come from across the town because this top surgeon referred these dizzy people to me. And so that taught me a lot because from that I realized that we should be more confident in what we do. I now have a whole host of MDs and physicians and their kids and families that come to get adjusted. And one day, this is, again, my chiropractic self-esteem wasn't as high as what it is today, but I was adjusting this GP's lower back, and she laid on, I'll never forget it, she was laying on her back and she said, oh, you know what, you've done a great job with my lower back, she said, but I once went and I was tiptoeing around her neck doing like little joint play and maybe some cervical stairs stepping on her neck and thinking, oh, I won't do the manual adjustment in her neck because, stroke and all this weird stuff that everyone worries about. And she said, I went to this osteopath one day and he did this thing on my neck where it just released all that pressure and tension. And I went, oh, what do you mean like this? Poof. And I gave her a good, and she went, oh, and she just laid there, took a big, and she just said, you must love what you do. She said, you get immediate therapeutic impact. You have no risk associated with what you do. And I was going, not if you ask us in the university, And she said, patients get immediate gratification from your therapy. They walk out feeling so much better. You get to turn everything around on the spot. You have no risk. You have maximum benefit, and it's low cost and low effort in terms of having to chase things up, doing testing and all these things. She said, you must love what you do. And I went, hell yeah, I do. And that's what I hope you get. Because you can't not be adjusted and be changed forever. Regardless of how big your attitude or your ego is, when you get an adjustment, it turns you on. And anyone who gets an adjustment, even a child who can't communicate to you, when you get a good adjustment and the nervous system's working better, there is physical and physiological signs that happen. We breathe and relieve better. We tonally relax more. We're more soft in our neurology. We're peaceful. So those are the things that we could bring to the table to offer people more often. Wouldn't you agree? If our self-esteem was higher, and with students it's generally not always the way, because you're just fumbling through a pubescence of sorts. But if your self-esteem, you could keep building your chiropractic self-esteem, then you'll have more to bring to the table. I say to our associate DCs all the time, an interchange between you and me as practitioner and patient, if you want to call that, or client or practice member, is that I am a flame today. I'm a candle. And I'm hoping that with my adjustment, I'm going to light your candle or make your candle burn that much brighter. And so if I don't have a very big flame, I don't have much to give you, then it's sort of maybe not that you're actually going to get much from me, from this interaction. But if I work on my confidence and I build my internal power and I let intelligence flow through me, because it doesn't come from me, and when you watch Kung Fu Panda, they collect this chi thing, you know? And you can feel it when someone is walking with a power in their cells. You can feel it when you turn a nervous system on and it pops. And so you have every right to spend the rest of your career searching for that. And I want to hold that carrot out for each of you to go, what the hell's that crazy Australian talking about? But when you know it, and when you feel that power go through your fingers and into someone else, and they go, whoa, what did you do? Then I promise you that you can expect miracles. Because when you feel an adjustment happens, and it's just boom. I had this week a lady who has been seen every specialist, every neurologist has been in bed effectively since she had this large boom noise quasi-stroke thing happen for 5 years, going to practitioner after practitioner after practitioner. She's been seeing me for a while, getting good results, but not great. So she's out of bed and she's coming to her appointments in my office and she's doing better. She's doing all these healthy things. Well, anyway, we both decided at the start of this year that it still wasn't good enough. And I said, let's both to commit much more head and heart space to making shit change for you. And she was like, I just so want to be better for my grandkids and all those other things. So anyway, through the series of whatever it was, the intention has been there since the start of this year. Last week, I set her up for an adjustment, and time stops still when you're in the right place. When you're in that place called present time consciousness, time stops still. In the same way that time stops still for lovers, or time stops still when you're in a beautiful rapport. And many of you will feel time stopping still right now because we're talking about it. We're getting into a zone of that. Can you feel that? Odd space of vulnerability, excitement, intensity, all that, right? That's present time. And we're in that because no one's really fidgeting. You see how no one's moving? It's wild, this stuff, right? So anyway, I was in present time consciousness, and I did this adjustment, and it went, and it felt like her whole temporal subarachnoid dura went like that, as well as this massive occipital adjustment. And both of us went, in a good way. And she said, that was it. That was it. And I went, so I'm just getting goosebumps talking about it now. And we both went, boom! I said, walk, Lazarus! No, I didn't really. Yeah, now I'm going, Kung Fu Panda? I'm going to be ripping my pants.
So I just thought it might be useful as well if you're wanting to hand around a piece of paper and put your email addresses down, because some of the content we're really happy to share with you. For instance, this is a study that was done in BMJ, and they looked at the 4,000, now the jet lag's kicking in for me, the 4,000 most utilised medical procedures, and they looked at what research they had to demonstrate how effective they were. Fascinating study. And what they found is that only 11% of these most commonly utilised procedures have been shown by research to be beneficial. And so there are large numbers of chiropractors in our profession who choose to feel second rate to medicine, because medicine likes us to believe that they have mountains and mountains of research that validate what they do. and they don't. And our profession has a building body of very, very credible research, particularly in regards to what is the vertebral subluxation and what is its impact. And I'm incredibly proud to be part of a profession that defines itself by the vertebral subluxation. You know, it's such a remarkable thing. And how well the nervous system is communicating sets the tone of our whole health picture. It's our inner compass. It governs every function in the body. And if we can start explaining this in very clear, simple terms to parents, that's what they want. And if we go back to our founding principles of the causes for a vertebral subluxation, the physical, chemical, and emotional, and we teach parents to think about, gee, what might be moving your child out of balance? Are they constipated because you're feeding them bum glue all day? You know, white flour for breakfast, lunch, and dinner. Or was it the fall that they had off the monkey bars, after birth trauma, all of those things? The genius of chiropractic is that it makes sense. We just have to communicate it more. So if you want to hand out a piece of paper, we have red flags that we can send you. Red flags to look out for in paediatric scenarios. The ones that need immediate referral, the ones that may need collaborative care. We have a red flags document for pregnant women, what to look out for, what to be mindful of. And once you get across all of those, there's something powerful in just letting it go. Having it be a part of your knowledge base with everything else that you're learning here, and then just stepping up and getting your hands on people. So growing up as a chiro baby, I used to sit in a tree house above our home practice. And I used to watch, quite honestly, creatures large and small, 7 days a week, come into our car park, come into our practice, and see my dad. And it was a phenomenal experience as a child. And I had therefore romanced the idea a lot about the kind of practice that I wanted. I wanted to see lots of babies and family and children. And then I had another wonderful gift of marrying Simon as I was starting to practice. Into Simon. And so of an evening, you know, I could go through case by case what was happening for me and get his experience. And yet that still didn't take away the very grounding realities that happened for all of us in those first few months. So in my first week, I recalled that there was a newborn baby booked in as a new patient. And I was like, gee, wow, you know, I've only been out for a little while. I wonder how that happened. And this midwife I had met through one of my siblings and started to build rapport with her, and she had recommended that this mum bring her newborn baby straight to our practice. And so I'm adjusting, and then I start hearing this almighty screaming of a baby outside of our practice. And this baby's voice is getting louder and louder as the mother and the grandmother and the baby come into the practice. And so like any of you, you know, my palms start sweating and my knees are shaking. And then one of our CAs escorts them down to our new patient room, and I go in and I start to look and eyeball with Mary the mum, the grandmother, and Holly the baby. And as they're telling me about her birth experience, Holly hasn't stopped crying. And I can see that all down one side of her face, inside her mouth, down her neck, it's all black. She's bruised all through this area. And so she had a traumatic birth. She's barely breastfed in the 3 days prior from when she was born. She's barely slept, and she's cried non-stop. And so my hands continue to sweat as I'm trying to take this history. And something just flipped. I got to a point where I thought, enough of that inner mental terrorist trying to tell me, who the hell are you? What are you going to do with this baby who's bruised? Don't you hurt the baby anymore. All of those things. It was like, gag that mental terrorist. Just tell it to shut up. And I connected with that inner strength that we all have. And I decided to get really authentic and just be present to all the different emotions that I was feeling, but to also connect with that inner strength. And so I took Mary's hand, the mum, and I said, at this point, I don't know exactly what's happening for Holly, but I want you to know I'll do whatever it takes to help her. And that was the honest truth, because I would do whatever it takes. And then I said, Mary, I want you to also know you're in the right place. And they were. And so at that point, as a new grad, I didn't know all the techniques that I know now. And so I did a Logan technique, and I did a few other things that I'd learnt, because I had a very good, wonderful pediatrician, a pediatric chiropractor who taught us for a few years. But again, certainly I did not know what I know today. So I did some techniques. Time stopped still, exactly like what Simon was saying. And I adjusted Holly, and I rang them that night. And the grandmother answers the phone, and she says, oh, Mary can't come to the phone because her and Holly are sleeping. They've been asleep since we got home. And so that family had a life-changing event from one adjustment, because baby Holly started to breastfeed, she started to sleep, that family could start bonding, connecting. And to this day, that family travelled well over an hour to our practice. And they pass a number of other chiropractors. But because we've built that very authentic rapport that we will be with them, we will be there for them, whatever happens for their family, that's how you create raving fans in your community. And I don't mean yah-yah fans, I mean women, parents, who will spread amazing, credible stories about what it is that you and your practice offer to other parents who need your wisdom and your guidance. And so that was, you know, the romance I had in my head about having all these wonderful, amazing experiences with babies and children. And a lot of the time, you can be terrified. Or you can be grossed out because they poop everywhere, or they wee on you, or they vomit on you. But pregnant women and parents are the nirvana client. So if you can start learning now how to educate these people about what it is that our remarkable profession offers, you'll be leaps and bounds ahead by the time that you finish. And that is one of the reasons that I wrote Well-Adjusted Babies, because, like I said, Simon and I have trained a number of associates, and it started out as a workbook for our associates, because I was quite a control freak, and every time I'd go on maternity leave, it was like, oh my God, I'm leaving clients to you. Come on, we've got to upskill. This is what you need to say. And it was this folder. And then it dawned on me one day, you know, damn it, here I am as a pregnant mum, and I want to know all the pros and cons of the different health decisions that I'm making. There are a heck of a lot of other mums and parents who want to know that information too. So to write it in a way that was understandable and readable for parents. And that's how that started. So I think we're getting some slides organised. Yep. So we've had mums who say to us today, you know, my child has this particular chromosomal issue or has this type of, I'll be one sec. You know, a health challenge that off the top of my head, you know, I may not be able to give her all the succinct answers that I want, but I'm at a place, and I welcome you to be at that point too, where you can just say, look, they are great questions, and how about we look at that together? And we both do some research. If you don't have time in that moment to be really present with her, say, how about we make a time tomorrow? And we go through everything that we found, and we look at what solutions are available. So it can happen still at this point in our career.
And look, if I look back every year I've been in practice, I've gotten better. And I often think, oh, if only I knew, I could have done this better and that better and this. It's a constant journey of improvement, and there is nothing better for you to say to a client that I'm committed. I'll do whatever it takes to help you, and I may not have all the answers today or this week or this month or even this year. Like I said to June, the lady's name is June J. And for any of you that really want to know, I can share. We can do a private group, or there's groups out there we can talk about good cases like that where you can't afford. She's been to all the Ted Carrick chiropractors and she's done all those sort of rehab stuff. And at the end of the day, she needed a damn good adjustment in the right way. And I'm still getting better every year at being a better and better adjuster. You never stop. You never do, Denise. You never stop getting better. And I think it's like a musician. If we all looked at ourselves like musicians in an orchestra, when you pick up an instrument, which is the human body, some people play it okay, some people play it really badly. And that's what I call a manipulation. And some people play it like a harp, and it sings. And I promise you, and I want you to hold me accountable to this, that if you get really good at being a chiropractor, you will never have to be a B grade anything else. And you will have miracles happen under your fingertips. And you'll go, hey, all I did was, this. But there is a massive difference between this line of drive and this, and the intention and the focus and the heart-to-heart connection you have to have with someone to really get an adjustment to set and shift the nervous system. And I don't say a lot in practice. I don't spend a lot of time. And I have people say to me, I have students observe me all the time saying, how is it that people, want to keep coming back when they've got to pay their $55 or whatever it is for 5 minutes? I said, because I shift their nervous system. And you don't need to fill the consultation with a whole lot of chat when I go, did you get what you came for? Are you brighter from that? And I look deep into the person's eyes and go, are you different from that adjustment? The animal in us knows when something's different. We know when we've had a good adjustment, even if it's your first or your second adjustment. When you shift my neurology, I am different. When you switch my brain on, I am different. So you just got to be good at being a good chiropractor. You can tell good music when it's played well. When someone plays really bad notes on a guitar or a harp or whatever instrument, it's just wrong. And you don't have to be a fancy musician student to know that. When a nervous system hums and it switches and the physiology releases and the breath agrees with you and the nervous system unwinds and the tone improves, they're chiropractic descriptive words. I'm not trying to be a B-grade medical doctor. I'm trying to be a great chiropractor. And if you just get that from us today, that's all we do. We don't try and make you think you have to study all these extra things, because not enough study is being done by us chiropractors in the magical healing art that we have. So my second story, I'm going to present this in Miami to all the real medipractors over there, is this story of a little girl called Zoe. Now she came in, and I kid you not, this is, because I put some context into this framework, right? It wasn't my best day in practice from a clinician's perspective if I was to be official and a lecturer like I often am. Right, but this little girl come in. She's on meds for depression at the age of 4. She's, in the history, I said to the mother, what? She can't go to school more than 1 or 2 days in a week. The medical system of tests and procedures and specialists have put her in and spat her out the other end and said, look, it's all in her head, she's depressed, give her these drugs. And the mother, to her credit, has said, not good enough. I'm going to take her to a quack. So I get this referral, and the mother's like, take her. She's driving me crazy. And it's apparently all in her head. So in my history, and this is a 4-year-old, so these kids are a bit more active, like they can resist, they can be hard to work with because they're not totally compliant, especially when they got a migrainous type of headache. Anyway, so I sit down, I said, so when did this happen? She said, well, she was playing on the playground about a year ago, and she ran into a bar, boom, into the forehead, boom, and she's never been the same since. Chiropractor says, oh my gosh, how simple does that sound? And of course, by this time, the little girl has got no nodding because she's stuck into occipital extension. So she doesn't nod. And I said to the mum, well, maybe the bar put her head off its neck. And maybe I should put it back. Complex discussion going on here. So I've said, let me have a feel, because that's called an occipital subluxation. We check those, we correct those every day. But let's see. So I now have about 15 seconds for this child who's been prodded and poked and injected, plus on meds, plus told she's crazy, plus got a bad headache for over a year, to lay on my table whilst going, meh, 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 complain. So I've felt the occiput. I've turned like this to the mother and gone. And she's gone. This is the extent of our range of motion, orthopedic testing, gone. Not there. So in under 10 seconds, I've gone, boom! And this kid's gone, ah! And the mother's gone, oh, she killed her! And the occiput's gone, and if you know what an occiput adjustment is like, it goes clunk, clunk. And I've gone, that's what I was after. And this kid gets up after she's in tears, the mother's hugging her, I'm crying, mother's crying. I've said, I think we did what we needed to do. And I'm sorry I didn't go through the whole palaver of risks and benefits and tests and but we connected, and I got the nod, which is my informed consent. Now, this is a closed group, right? Okay. But when you understand the context of this situation, I'm trying to teach you about sometimes innate has to talk to innate, and permission has to be granted because it's coming from the right space, and we can't always follow our procedures, and we have to follow something greater than us. And on days like that's when miracles will happen for you. And so I just knew it. I knew what I had to do, and I just did it. And I wasn't reckless, I was just clear. And this little kid is fully back at school. She's nearly 14 now, has the occasional headache, but when she went through her pubescent sort of growth spurt, she started getting these headaches back again. So anyway, we had another round of MRIs, and they found a cyst as big as like a walnut in the frontal lobe of her brain, because the brain trauma she'd had but didn't show up on earlier scans was massive. Now, I didn't know that, and we'd had this barrage of testing, and they'd put her on these drugs, and what if I didn't do anything that day? And I watched that concussion movie on the plane on the way over here. I went, hello, a chiropractic story? This amazing doctor has worked out that if you bang the head around inside the skull playing football for years, it causes massive trauma to the nervous system. And these poor guys, these actors, thank God, but I'm looking at these football players going, oh, my head. And you imagine the techniques we can do to free spinal fluid and help give nourishment to the nervous system and to give improvement of conduction of electricity through a traumatized brain. Who's the best people for them to see? I know it's us, but do you know it's us? Watch those movies, both of them. Watch that concussion one again and put yourself in there. And would you be the one to go, excuse me, these people need to see a chiropractor. Let's see what the difference is on these live people with their symptom presentation, their soft neurological signs after they get chiropractic care. Imagine what that would do for you in your practice, going out there with that confidence. So in my first year of practice, naive bozo here, the local guy in our area was Australian pole vaulting champion. And I said to him, you know what, chiropractic would really help you, twisting your spine like that and landing funny, and I could really help improve your performance. I didn't know any better. Someone told me that was something chiropractic did. And so I said, look, how about I adjust you before you go out there and train? And he's like, this feels really good. It really opens my spine up. I can move better. Hello. So I said one day, before the Australian titles, I said, hey, how about I come down to the track and we adjust you just before you jump? So your nervous system's really clear, no interference, you'll be all over it. So lo and behold, he breaks the Australian record. So guess who has to then go to the Atlanta Olympics? Because he wasn't going anywhere without me. And so at the age of 21, yours truly got to go to the Olympics as a chiropractor, was not allowed into the the village, because chiropractic, no way we were in there in those days. And so I was in the little polyclinic, and I was adjusting away, and someone said, I don't know if any of you are old enough to remember who Dan O'Brien was in those days. He was like the US decathlon gold medalist. And so everyone, all the American chiropractors there peed their pants at the thought that Dan O'Brien was wanting to get an adjustment. I said to this Aussie guy, do you know him? He said, yeah, he's another, decathlete. Yeah. And so I adjusted Dan O'Brien. He comes in. I'm like, you've got a spondylolisthesis. That wouldn't be good for your lower back. And they were like, his two team people were there writing notes. So what do we have to do? How much water does he need? Like he was like this primo athlete they were watching out for. And I got to adjust him. I then had to get taken to the Ritz-Carlton to adjust him because he didn't want to go to the polyclinic, and he was this celebrity in America. And the stuff that will flow on from you building your self-esteem and your chiropractic confidence is immeasurable for your life and for your practice. So can you imagine how many kids are playing football in America, getting head trauma every day, getting neurological compromise every day, and how many chiropractors are out there building a practice off the back of that? Hopefully more and more of you. And now, using the great storyline that Will Smith has put into this concussion movie, you have legitimate reasons to get out there going, hey, crikey, we're the best people to help you change from trauma to improve spinal cord function and brain function. Get with it, people. So that could be a great to-do list. Start checking these kids now. Start finding out what is the best way to correct the subluxations, what are the most likely subluxation patterns that happen with concussion. Anyway.
All right. So one of the things I just want to talk about now is the vision for pregnant women, and then we might touch on how some of the techniques we use with pregnant women, and then we'll get on to some kiddos. So lots of chiropractors, when they think of working with pregnant women, kind of freak out a bit because, I can tell from, or I know very firsthand from lots of pregnancies, we're hormonal, we're emotionally challenged, and sometimes chiropractors, they worry about working with pregnant women, they worry about bringing on labour, hurting the baby, a lot of those things. And again, that's why those red flags are really useful. I did a weekend seminar with Liz Anderson-Peacock. Are you all familiar with her? And the Spinal Research Foundation filmed it, and you can still access that. And we go through 2 days of how we assess a pregnant woman, what techniques we use, and all of that money goes to the Research Foundation. So if that's something, additional information you'd like, that's a presentation that Liz and I did. And the reason that I would say pregnant women are the Nirvana client is because there's so much more involved with pregnant women than a lot of us realise. So traditionally as chiropractors we think, okay, about 80% of pregnant women have back pain in pregnancy. Lower back pain, pubic pain, thoracic pain because our boobs get bigger as well. It may be that we have headaches. So 80% of pregnant women, because they've had previous knocks and falls, with the hormonal changes, physiological changes that happen in pregnancy, it makes sense then that she is going to further subluxate and have all sorts of presentations. And so we know this, and a lot of pregnant women are wary, or becoming more so wary, of taking drugs during pregnancy, pain-relieving drugs, and thank goodness that they are. I mean, sadly, there is some research that shows a Norwegian trial, 83% of pregnant women have taken some kind of pain-relieving drug during their 3 trimesters or their 4th trimester post-birth. And in a little while I'll talk about some of the ramifications of that. But more so, pregnant women are starting to become aware of not taking drugs in pregnancy because they're having an inkling that, my goodness, what's happening for our children today? Is it related if I backstep to some of the decisions I make during my pregnancy? And so what can happen with chiropractors who come from a bit of an inferiority complex? They might think, okay, so here I have pregnant Jane in front of me. She's got acute lower back pain. She's referred by, you know, her obstetrician or her midwife. So I'll start talking to her about her lower back pain. And we all know that chiropractic works remarkably well. And so within a few visits, Jane is starting to feel better. And yet, if we hold out, if we think, oh, once I've built more rapport, once she's feeling better, I'll start to tell her more about chiropractic, we can lose that opportunity to guide that mother and her family from there on in. Because what happens is she feels better, she thinks she's gotten all that she can from chiropractic, and she goes back to her hospital antenatal classes where they tell her it's a great idea to have the flu vaccine with 4 neurotoxins. They tell her it's important she has lots of scans. In the preparation for birth, they go through things like if labour gets really hard, you're in the right place because we've got all of the equipment and all of the pain-relieving drugs to support you, because labour can be really hard and it's really painful. And they start getting into these women's heads about what birth is all about. And so before we know it, there's a vast majority of women living in fear about the birth experience. And so she's having scans, she's having the flu vaccine, she's thinking about, well, whatever happens, it's okay, I've got the hospital there, I'll have that backup. And before she realises it, she's having a hypermedicalised birth, where her baby's induced, where she has a caesarean, where her baby is whisked from the abdomen, loses the opportunity to pass through the birth canal and have the pressure on the skull and the respiratory centres to expel, and all of those mechanisms to expel the muck from the chest, loses that opportunity to have the pressure on the chest to finish that sequence so that those respiratory organs function really well from word go. And so that baby loses that opportunity. And that baby is then whisked away. Mum and baby don't bond and connect right from word go. And then, often not, the hospital encourages formula. So, if I sidestep for a minute, lots of governments worldwide are now talking about non-communicable diseases that our children face. And they predict that those diseases, so I'm talking about asthma, diabetes, Crohn's disease, asthma, diabetes, Crohn's disease. There's a slide there, sorry, the jet lag's kicked in. There's 5 of them, they'll come to me in a minute. Are all related. This is the latest research, because governments are now searching worldwide, why is this happening? Why are we seeing an increase in non-communicable diseases? Because they predict, not because they're really concerned about our children's health outcomes, that by the year 2030, here in the US alone, they will be spending $47 trillion helping children with non-communicable diseases. And so the research they found is that there's 2 main contributing factors. How our children are born, their mode of delivery, whether they're caesarean or whether they pass through the vaginal birth canal, or whether they're breastfed or formula fed. Those 2 factors set up the microbiome. Have you all heard that term? Yep. So when the baby passes through the vagina, they get exposed to huge diversity in bacteria. That changes in those weeks in the lead up to a birth. Bacteria that sets up and seeds the immune system and their digestive health. There's research that compares babies born by a caesarean to a vaginal birth. It takes 7 years to re-establish the difference and the void in what a vaginally born baby has exposure to than a caesarean-born baby. Caesarean-born babies, when they test their bacteria, have hospital bacteria. We're talking strep and staph and all of those things versus the important bacteria that sets up our whole immune and digestive system. And so when these women have a caesarean, they're less likely to breastfeed. Breast milk is the second seeding of that whole gut-brain immune axis. So what I'm saying is that when we don't step up and start talking to pregnant women about the power of chiropractic in pregnancy, because it's not about her back pain, it's not about her headaches, it's about her understanding that regular adjustments during her pregnancy help her and her baby move towards a much more straightforward labour. Now, I've had 5 very, very different births, and I don't ever assume to know what type of birth another woman would want. So I'm not taking a tone of you should have a vaginal birth, you should have a natural birth, any other type of birth is bad or wrong. That's not how we set up a relationship with these women. But we start a conversation that all couples are different, all women are different, we'll all have different birth references, but I want you to know that if a more straightforward birth is something that you're interested in, because as a parent you've probably started to hear about how our babies are born, whether they're breastfed or not, can have a huge impact on their long-term health. So if that's something you'd like to explore, I'm really happy to talk to you more about that. And that plucks up their interest, and then they'll come back to you and you can run workshops and all of those important things. So if you hear chiropractors solely talking about chiropractic in pregnancy for lower back pain or for headaches, please hold on to the fact that what you do and the conversations you have and the masterful adjustments in pregnancy can change those health outcomes for families for generations. Does that make sense? Yeah? Okay.
So we call that being in the fight, but not fighting. No one's purposely doing anything wrong in the living of their life. But there is real and actual consequences for things that happen, like a caesarean birth, or not breastfeeding, or choosing to have lots of meds, or all sorts of things that it's being in that fight that we've got to realise that people are really suffering. They're getting sicker out there, and we're in the fight. We are leading health professionals who have an answer for the majority of the community. Just the fact that we use our brains, even if I wasn't to be adjusting you, I'm still got so much to give you, just with my understanding of the way the body works. Just with my ability to think outside the square. This stupid health system that we're in leads everyone to think that they don't need to be responsible for their health. Leads everyone to think that meds and those outside-in influences are okay. There is not one person in agriculture or horticulture that would not look at the environment of a tree that was dying and try and consider that. But no, you keep having your 12 bourbons every day and your packet of cigarettes, and we're going to give you something for your asthma and your whatever else, your headaches. It's ridiculous the healthcare service people get. And we're in that fight because people every day are going to come to you with preconceived ideas or a really good doctor having told them what's really wrong with them, and you're going to disagree because you're going to go, hold on, you can't drink 12 bourbons a day and operate and just take antacids and headache meds in the morning. You can't run the body that way. And so it's your thinking that can help people. So although we've brought up a couple of issues with the health system, it is what it is. And we have to be in that fight for our clients and the patients in the community out there because no one else is being in that fight for them. But we don't want to fight, right? If you don't want my information about why it's important to breastfeed your baby, that's okay. I had a lovely mother who's just so into chiropractic and getting adjusted, and her breasts for her, psychologically, emotionally, are part of her sexuality, not part of her mothering. And from the get-go, she's like, I'm not breastfeeding my kids. I'm not having these change. I'm not having them getting enormous like my mother's and come down to here like my mother's, or whatever is her perception. And so she was never in a go zone of her breastfeeding her kids ever, ever, ever. But she would be happy. She was at the hospital with the probiotics and the specialty formulas and the things to help the child get over that. And so it's about working with people without judgment. I was in that fight with her, but I wasn't fighting her. This woman with the dizziness and this physician, this top ear, nose and throat surgeon, I was in that fight for the patient, and I wasn't going to try and make him understand chiropractic. Whatever he thought I did. And so I take it like a sport. Dealing with people has to be a sport for you. Because some people, it's taken me 20 years to really understand chiropractic. So how could I expect you to get it on day 1, or day 5, or day 7, or 1 year down the track? It's a sport, being a health leader, and that's what we're in this for. So are you getting some of these things? These courses, this is a really good one. It's for the Spinal Research Foundation. It's accessible. It's great. So little tick notes to go, hey, I could check that. I can get that. When I talk about neurophysiology or soft neurology in kids, one of the great things Jen did in this book, it should be called Well-Adjusted Kids, this book, not ticklish, but we're trying to make it a simple book for parents to understand how to monitor the developmental milestones in their own children, and to change one thing at a time to help your child meet all its developmental milestones, so that by the time it gets to school, they're not going, ooh, little Johnny's not going to cut it. He's got developmental delay. And the parents go, really? This stuff shows up to a chiropractor looking at kids walking down the street. You can go, oh, something's going on there. We should check that. And if you can orientate parents to go, oh, is my 18-month-old child doing these motor skills, these communication skills, and here's some suggestions for me to be empowered to help my own children develop. And then, of course, if there's a glitch or a question, wouldn't it be better that they come to the chiropractor and get an adjustment and some holistic lifestyle advice than, what, more meds? So you can read this book in an hour and go, I got this. I got this developmental milestones thing in kids. And I've got a reference here, we can tick it off, and then parents will come in and go, oh, my 18-month-old child, he's already hitting some of the 2-year milestones. And we get them adjusted, and Jen's got these wonderful little tick boxes at a time that you can do, feeding your kids fresh fruit and vegetables. Hello, I can do that. Minimizing, giving them good, clean drinking water. Tick. Building my parental self-esteem here. And then it says, check your child for subluxation. Look at its hairline. Whoever thought of that? Parents come in and go, look at this. Look at, what's your name?
Kelsey.
Kelsey, look at Kelsey's hairline. Oh my God, Simon, does that look like she's got a subluxation there? And you go, hello, evangelist. Working for me. And they go around the school, and you get a hairdresser checking that sort of thing, and you get referrals every week. Simon, I'm really concerned about Kelsey's hairline. It's really crooked. And I think she's probably, in fact, when I even feel it in there, there's like a knot. You can teach a hairdresser to do this when they massage the scalp bit. Do like a little workshop for them, teach them how to check for cranial, and then check suboccipital. Is that tender? Hello, everyone's got tender suboccipitals, but you can get them to partially list for you. And then where else are they going to go? You need to see my chiropractor, because that's probably where your headaches are coming from. Hairdresser here can check. This is simple stuff, and it's real, and it's obvious. And you start pointing that out, you get an army in the community focused on neurology, development, and the nervous system. Man, we have got you guys are coming into an era of chiropractic where communicating to people is so easy because they're open. My grandmother, if she went to her physician and he said, we're going to take your left arm off today, she'd go, okay, doctor, thank you. Oh, you're amazing. Oh, jelly bean. Oh, awesome. Take my arm as well. That's what there's 2 generations that were taught not to question. Whereas you guys have got a generation of people who don't trust don't trust anyone anymore. And so we get on the net, we do our Google search, we go, I already know what my diagnosis is. Are you going to confirm that for me? So why wouldn't you get them focused on something that's more real, more tangible, and something that you can monitor and show them results today?
And if I can just add to that, I hope you're appreciating that when Simon and I talk to people, we try and make all of the stories and the languaging very relatable. And yet we use research like this for us to know the incredible value of what it is that we offer. And then for those parents who want more, you can share all of this information. This is the slide that I was talking about. So the Canadian Medical Journal stated that the mode of delivery and the lack of breastfeeding disrupt gut balance, which has been linked to an increasing number of diseases, including inflammatory bowel diseases, diabetes, obesity, cancer, allergies, and asthma. And so then if you Google non-communicable diseases, you'll find those financial figures that I talked about as well. Now, it's important when Simon's talking about developmental milestones that we've already said, yes, chiropractic for pregnant women is way beyond headaches and lower back pain. It's about helping them move towards a straightforward labour. It's about helping them post-birth with breastfeeding. But back to pregnancy. When that mother has her pelvis moving well, when it's free of subluxations, that baby moves well within the womb. And you've probably heard that. So they start having all of their neuroplasticity develop fully. So there's research that shows children who have developmental delay, one of the contributing factors is in utero constraint, which is why Genome is so right in saying that Webster technique is a wellness technique. It's not just about turning breech or transverse or posterior babies. Okay, we use Webster on all pregnant women. We use myofascial release technique on all pregnant women if it's warranted. Logan technique. Because what they do is help to release and balance the ligaments. There's 4 main ligaments that hold the uterus, if you imagine like a balloon, that sits on top of the pelvis. And if from previous knocks and falls and traumas, those ligaments are tightened on one side, then that balloon twists. And that creates constraint around that baby. And it's damn hard for that baby to move within the womb and learn in the way that it's meant to learn, because babies in utero learn through movement. So if they can't move properly, their brains don't develop fully or in the way that they need to, and it takes them a lot longer to get those synapses happening in the way that they would. And so the adjustments help balance the ligaments of the uterus, the myofascial layers of the abdomen and the pelvis itself. So that's another important reason for adjustments during pregnancy. But this here, this slide, or the one that talked about the T1 to a T2 shift, that's the immune shift that typically happens when a baby is born with a natural birth, when they're exposed to the environment and germs and the dog and all those things that happen when parents aren't germ-phobic, when they don't use sanitizers for everything, when those babies are born through a natural delivery, when they're breastfed, that immune switch happens. It doesn't happen when they have that whole sequence of events. So they're the children who have chronic runny noses and black under their eyes and allergies, and they react to everything. Part of the reason that shift doesn't happen is when pregnant women get an inflammatory response in pregnancy because they take drugs in pregnancy because they're in pain, or they've got a cold or a flu because their immune system is challenged. So part of the education we have is the process of reminding pregnant women that chiropractic, again, well beyond everything we thought before of headaches, lower back pain, straightforward births, breastfeeding, babies moving in the womb, it's about increasing their health and vitality. So they're less likely to take drugs during pregnancy, so that their babies are more likely to have this immune shift. So when they look at children also who have ADD and autism, a vast majority of those babies had mums who took antidepressants in pregnancy. And John Minardi and a lot of other people who talk about the research in relation to stress offer a lot of valuable information on what it is that we offer, not just pregnant women, but other people with their emotional well-being. Am I making my point? There are so many incredible, valuable things that we offer pregnant women in setting up children to thrive. Okay, so I talked about some of the pregnant techniques that we use. We probably don't need to demonstrate those.
We've got about half an hour left, I think.
We move on to kids, or what would be most useful?
Kids.
Kids? Okay, so let's do kids, but can I also ask that in addition to a Webster technique or a Logan technique that you use, if you could look into myofascial release techniques, and the ICA Peds Council teach that, Dr. Sharon Valone. With our 5th pregnancy, wherever Arlo is, I was breech, and I had Webster, I had every technique. I had, you know, #1 chiropractor in the world for me, adjusting me. Other chiropractors, nothing was helping Arlo to move. And so we were at a seminar, Sharon Valone demonstrated the myofascial release technique. Within 1 adjustment that night, I felt Arlo move down, and then a 2nd adjustment, he was in that amazing birth position. So again, the point is, as many techniques as you can in your toolbox is incredibly important. Yeah, kids.
Yeah, sure. Is there any burning questions so far? Come on, someone's got to have something that... Give us some idea, feedback.
Have we stretched your
Headspace?
headspace about...
Have we adjusted you north of the Atlas? Great.
Is that new for you to think about pregnant women in that way and what you offer? Yep.
Okay. So all of these slides are all that research, and we can send it to any of you if you'd like it. We can. I mean, much of this stuff is in Jen's books. This is why women love it. Distilled down into common sense information with over 1,000 references in Well-Adjusted Babies to explain why adjustments are so powerful. And if you give this book to any pregnant woman, they end up coming with under their arm, already educated, saying, look, do you need me to come in every week to get adjusted? And how do I book my unborn baby? And I don't know when it's going to be due, but it really needs to be adjusted, doesn't it? Because I read about that. You know, so this is the change of consumer. You give them the right information and they take it. And they take it deep inside themselves to say, I feel confident. I feel more confident as a parent. So that's our plan. This is the sort of thing that happens within 5 minutes of doing good adjustments and helping a woman who's constrained in the abdomen turn into a woman who's holding, having room for her baby and for the baby's developmental plasticity and movement within the womb to stop it getting a flat head and to help its brain and nervous system develop because it can move. Because when it can't move, there's issues with its nervous system. It's that simple. I say to mothers, if you're constrained and you're pulling your baby back, it's going to cause, into your spine, it's going to cause back pain, of course. But if you can let the uterus fall forward and be pendulous the way it's supposed to be in pregnancy, then your baby will have more room to move, it will develop better, will have less likelihood of a flat head, and positive benefits to the nervous system. Nelson, would you mind getting the keys from Shiva and getting the baby that's in the suitcase in the car? We bring our BYO baby. And then we can use that to do adjustments on. It's in the suitcase. No, we need a baby. You're an adolescent. Here's another example. So I've started taking photos of these in the practice. Boom. This is in 5 minutes, one adjustment. Can you see the abdomen? Am I dreaming here? Can you see this abdominal change? Yeah, they got TV cameras. They're all monitors there. Yeah. So you can even see on this reading left side. Can you see the indentation from her constraint? Can you see the tightness, that bump in the abdomen at the upper and lower area turns into a nice round smooth abdomen. You see a woman walking along with a constrained uterus, it looks weird. You can say to that woman, I think you should be checked for uterine constraint. Have you been checked for that? It'll help your baby move well, helps it develop well. It'd be a great thing for you to get checked by a chiropractor. By me. You. Perfect chance for you to say, can I just check this? Can I have a feel? These weirdos from Australia said we should have a look at this stuff. And I happen to be studying this, and it's really important. And it's good neural information. It's not someone's special technique. It's using your brain as a chiropractor, looking with a chiropractor's brain and saying something's wrong with the shape of that uterus. It's not going to help the baby. How about I help you? No one else in the community is going to tell you about that. No one else is doing this for the mothers out there except the chiropractors, and only the real chiropractors. And I'm being rude saying that, but I'm getting more confident saying that. Because it's you know what? It's an insult to you to be a B-grade medical doctor. It makes me tear up when I think that chiropractors are missing out on chiropractic. I'll guarantee you in your lifetime we will be protecting our art because everyone's going to want to steal it. It's so damn good. If the chiropractors would damn well wake up to the fact that we've got this magical tool, that'd be great. And hopefully many of you in here have gone, geez, maybe there is something more to this than I even knew. And I promise you that's true. And it's simple. It looks simple. And the techniques we use are subtle. But you know, playing the guitar well or the harp well is subtle. It's not gross. Manipulation of the spine is gross. Adjustments of the spine is poetry. It's magical. Have every one of you felt shifted by music? Do you know what I'm saying in here? Because when you get shifted by something, it's a tone. The nervous system is sonic in nature. It conducts some current that is probably not electrical. It's more likely sonic if you really read into the research. And so is it that maybe we're tuning our ears or our senses to the sonographic changes that we can make in the nervous system? What if you were a masterful magician, musician, and were able to feel current changes in your fingertips and to instrumentally change that and play these bodies like a harp? Because that's what you see when you adjust babies and children. They literally move with you because they don't have the psychological overlay of issues. They either get adjusted and love it and change and neurologically shift shit in front of your eyes and the parent's eyes, or they don't. And it's probably the musician that's the problem in that case. And that's why it's worthwhile getting your skills and upgrading them and hanging out with people who believe this stuff and know this stuff. We just put down, because we have to travel so far to see everybody, we just these new apps. You can download our free app, and we've got like Netflix channels that you can get of some of these locked channels on teaching chiropractors these techniques. Up close, right in there. So that's the sort of stuff we want to do more and more of and start sharing our skill and our art with each other. Because that's what we need to do, is to get your belief up, your chiropractic self-esteem up.
Sorry, we make that sound like it's an app. It's available on digital devices, but it's,
Thank you.
it's really
Be gentle.
See what we would do to girls in our house? It has a number of, it has 22 different videos in varied length. So
Okay.
if you just have another look at those constraint pictures and how I was talking about the uterus twisting, when you then have a newborn baby that, you know, is potentially lying on your table with a pillow, or you know, initially the mum may be holding them, or you may be holding them during the exam. But a useful thing to do is to have them lying on the table and to look at their presentation simply by that. And I'm jumping around a bit here, but it was related to the pictures of constraint. Because if you have a baby that is then, can you just hold that for me for a minute? Lying on your table in a banana bend, like this. I'll hold it up, yeah. So they're lying on your table, but they're sort of twisted towards one side. Can everyone see that? Or if they've got one of their hips rotated off the table, they are all visual cues that there's dural tension going on for that baby. So the meninges subluxate just like the spine does. And so that's why a lot of tonal and dural techniques for newborn babies and babies work incredibly well. And that's why when Simon talks about, you know, musical instruments and that time standing still, a lot of those tonal dural techniques that you use with newborn babies are very, very subtle, but they have a huge response in the nervous system. And so just use that as a visual cue to have a look at whether there are those dural visual cues of what's going on for babies, because for most of the time, those tonal techniques are everything that you need for a newborn baby. And they are incredibly gentle and safe. And that doesn't mean that there's not times where we may feel a manual adjustment is warranted for a baby, perhaps not a newborn baby, but for an older baby. Now, you may have chiropractors who've, you know, run pediatric courses who will say, we don't manually adjust children under 6. Some of them say 4. Some of them say 8. No manual adjustments, that's not okay. And they will have their reasons for that. But I can say that I've been adjusted since the day I was born by a vast array of techniques. And I'm still fairly well composed. What are we looking at there? Oh. So, tonal techniques, like a Logan technique. We use Logan almost always with newborns and older babies. So working on the sacrotuberous ligament. Are you all familiar with that technique? Yeah? Okay. We go through...
No, that's perfect. Wow. How lifelike is this baby? This baby is the one they use to give to teenage girls to deter them from being promiscuous. They take it home and they have to look after it. It's the same weight of a newborn. It's so lifelike. How's the hair? God. Anyway, so as Jennifer was saying, you know, one of the great things about checking babies and infants is that you can assess the function, the good function or bad function of the nervous system by observing a child. So an infant with high cord tension will be, like Jennifer said, in a banana bend, in a banana bend of cord tension, or they'll be hyperextended, and the parents saying, "Oh, she throws their head back," and they look like they're in pain because they are. And a baby should have soft neurology that enables you to relaxedly touch its toes on its forehead while putting legs straight. You know, you should be able to roll up and roll down. And the baby should go, maybe a bit of gas come out, something like that. But a child, as you go up into, you know, here and starts going, it's like trying to get me to put my feet in my mouth, you know, like, you know, but mine will be from muscle tension, not from cord tension. And so you can tell cord tension. This child has been in the womb like this for 9 months. It should be able to do that easily unless it was yanked out. And so the first thing I'll say to parents is, gee, it seems like your child has fairly high cord tension. Or, you know, you're out with friends at a party and this child's got high cord tension and, you know, can't even turn its head and not really happy and pulling those sort of faces. You say, gee, it looks like your child has high cord tension. What's that? You know, you're perfectly positioned to educate these people. So then the soft neurology, these children, you know, when you're checking their hips or, you know, motion in the spine, there should be this softness in the way these babies move throughout the whole nervous system. And we're strong enough to be able to hold the whole nervous system in your hands. And this child should be like butter. Cross cord tension, flexion, extension, lateral flexion. This is how babies should move, right? Happy, soft neurology. It doesn't take a rocket scientist to work that out. And then if I press here in the sacrum, pelvis area, I can do all this whilst I'm looking at this beautiful baby. You know, you don't have to be a chiropractor fully graduated to start assessing and feeling the nervous system of children. I can do this. I'm literally doing lateral flexion movements of the pelvis and sacrum with my fingers over that area. Then I can move up the back. I can grab my hands under the thoracic area. I can do the entire thoracic spine with my fingers. P to A, lateral flexion. It's a bit of traction there, so I can get this incredible amount of assessment capacity of a child's nervous system by just holding the child. And of course, I'm pressing in. If the child's going, every time I hit T4, guess what? And I don't know if any of you, I say this to parents all the time. So I don't know how you would feel. How cool is that? How you would feel if I was to get one of you, anyone want to volunteer, come down here. I'm going to mimic what would happen in an instrument birth. So I'm going to grab you by your hair, and I'm going to drag you along the carpet here while someone holds your legs at the other end. Okay? And I'm going to pull, and I'm going to pull as hard as I can until that end gives. And I wonder if you'd never had to hold your own head up and never used your postural tone muscles in your neck ever before, and I yanked on them with a force that would curl your toenails, or whatever they say. Make your skin crawl. That was what I was thinking. Thinking chalkboard, skin crawl, jet lag. You know, there's going to be a problem in that baby's neck. Wouldn't you agree? So anytime anyone says, oh, we had to have instrument, or that bruise is from instrument birth, I go, oh, who's checking it? Who's doing the correction? Who's reversing that injury? Oh, no one said anything about that. Hello? You've got to see a chiropractor. Let me check it, and I'll see if that child's got some problems. Then you'll know why it's so unable to feed or so unhappy. I mean, it wouldn't be fair to you for me to drag you along the carpet by your hair, would it? Let alone if you'd never lifted your own head up before and I did that to you. And then, of course, I could get some big salad spoons and try and clamp them on your head and yank you with that, bruise your cheekbone and your tongue and your face and your ears as well. Again, who's helping these people? Who's flagging that with them? So if you don't have the confidence to do that, use ours, because those kids need you today. They can't wait another year when all those subluxation patterns set in. So, I mean, look at these pictures. Does that kid look like it was okay? You can't let these kids get ahead in life when they've already had their head yanked. So, because I don't... this amazing technology. So, you know, this is the extent of a cervical... You know, you've got 1 inch, if you're lucky, of tissue here to assess the 7 vertebrae in the cervical spine. So this is the extent of my range of motion test. Anytime you do this to a child, a parent goes, so it's not necessary. You can just tiptoe through the tulips here. And, of course, my finger's going to cover about 3 segments. So wouldn't you just rock and feel forward and back, lateral flexion, rotation is this much. And then all you need to do, oh, this is weird, is, I call this a cervical release technique. I find the subluxation and I pulse it, press it. Now, on some occasions, it'll feel like a P that's hard. Most often, it just feels like the joint play is minimized or restricted. So I will do this, and on occasion, I do a little flick like that. If it needs to go anterior, it needs to go posterior, I just slide the vertebrae there. And then what will normally happen is the child will get a physiological response and they'll go, and then the magic happens, right? So usually when you find a subluxation in an infant, they will go from to, what are you doing? Like, look, and time stops still. And the parents go, what's going on there? And the room goes quiet, and the baby goes, oh. And I usually say to the parent, I'm scratching their itch. You know when you do it to a cat and they go, oh, yeah, right there. Yeah, that's it. Yeah, that's what a baby does. They go, oh, somebody is scratching my itch. It's that simple. You just got to look for it. Get your hands on these spines. Very, very seldom do I ever have to put a bigger input into a child's spine than that. I say to the parents, it's about the same pressure that I put on my eyeball or yours. So don't fear. When I correct the subluxation in your child, it will be this pulsar force, sometimes with a little flick either way, but never really more than that. Seldom, not never. Seldom is it more than that force. Should not need to be. And you should have a cascade of neurophysiological events happen. Deep breath, tone change, one of those internal yawns, really? And the parents will go, shut the front door. What was that? And get it on film. Because in the palpation, the innate intelligence is going to want to get rid of the pressure. And so in just you as a student palpating an infant or a child, they'll be like, oh yeah, you got me, yeah, that's it. And you can start unwinding that neurology, just moving them through those zones of range of motion. You will get change. You will get them assist you. The Logan technique, is the south end. The notch. I'm going to pull that up on the picture. Oh, actually, I'll turn this baby over. Oh no, this is good for now. So you've got your ischial tuberosities, and you've got the sacrum coming in. I'm going to do it here. Sacrum, ischial tuberosities. So the sacrotuberous ligament runs around like this. So really, it's your thumbs going like this. So it's like a little corkscrew. You're going to feel along the sacrotuberous ligament for where it is lacking in rapport. I say to people, it feels like wood when it's got tension and cord tightness. The sacrotuberous ligament feels like wood, and when it's relaxed, it feels like nice rubber. So you put your thumb here and hold. Look at me go. And wait. And then you can go around the notch, and the child will start to physiologically change. They'll relax, like, oh. And if you've never had a Logan, it is magical. And you lay there, and then usually there'll be a sweat response travel up the spine. They'll help clear out their thoracic and their cervical, and then they'll go, oh, I'm done. Less than a minute. And the cord tension is relieved somewhat. And then you go like this on the sacrum, and it's like butter. And the baby is relaxed. And the parents go, what did you do?
And if we can dare you, as students, to just get your hands on as many babies as you can, and with consent, obviously. But if you're at a busy party and there's a baby and the parents are tired of holding the bubba, there's no harm in you holding the baby and palpating and just getting a feel for dural tension, because the more experience you have as students, while you're gaining all of your clinical knowledge, and then as you move into student clinic, by the time you finish, again, you're leaps and bounds ahead. And that's so important for our profession at the moment, that you guys join us and many of the other chiropractors who are incredibly impassioned at the moment about protecting our profession, and that we all become a voice to reckon with. I'm watching Simon talk about issues like that with babies and how remarkably simple chiropractic is. And it's not a band-aid for colic or birth trauma or asthma or anything like that. Chiropractic isn't a remedy for anything, but chiropractic is everything in regards to nerve communication and the overall function of the body. Chiropractic isn't an alternative, it stands on its own. No one else offers what we offer. And I'm just coming out, having had Simon's incredible support, but 6 months really of a whole lot of legal issues in Australia, where, like a whole lot of other chiropractors, I have been incredibly scrutinised about what I can and can't say on social media. I've had the books looked at page by page, all of which we did a number of years ago, but it's all happened again because of some unfortunate stories that have happened in the press in Australia, which you're probably all familiar with. And the insurance company that our profession tends to have in Australia, they decided to assign a QC for my case. And I was sitting talking with him, and he said, so you realise that the issue really that the board has is that they believe they are to protect the public. And so when you talk about things like chiropractic is safe and effective for colic, and you go through that research, their concern is that pregnant women or parents are incredibly vulnerable, and are you taking advantage of them? And he said, because I can remember with my first baby, he never slept, and I was so desperate for something to work. And he said, so if I in that moment read your book that says chiropractic may be one solution for my baby who's got colic, and that it's been shown to be safe and effective, he said, I might choose to act on that. And I'm sitting there going, yes. And he said, and I notice you've got this research here, but, your profession, you don't have extensive research, is my understanding. So then we had a lengthy conversation about the research that we do have, the research that we've had since I've written that book. And I said to him, but can I ask you a question? I said, when you're up with your baby who's not sleeping, and you have the television on, and you see an ad for a drug that relieves colic, how is that any different from you realising that that's one option for you, to give your child a drug? I said, as a profession, we are presenting one option for parents. And for a lot of parents, that's incredibly valid because they don't want what's always been on offer with drugs and surgery for all the different health ailments. And so we talked for what felt like hours on numerous topics, and he, just before we came over here, submitted I think it was probably a 15-page document in my defence. We had mountains of research and all of those things. And it's been, this is not the first time that it's happened for our profession. And I'm not the first person or the only person. I'm not trying to say that in any way, shape or form. But the reason it's happening again right now is because the utilisation of chiropractic is growing in leaps and bounds, because what we offer works, and it is safe, and it's incredibly effective. And parents want that. And not just parents, like people in our community who are sick of the other options. More drugs and more surgery aren't the solution for what our society faces as health challenges. And so get your hands on babies, get your hands on as many spines as you can, learn everything that you can while you're here, so that when you graduate, you are incredibly knowledgeable, you're passionate, you're clear about what it is that you offer. And there are so many other wonderful chiropractors out there who are ready to help you at any point. Like Simon said, we still have people who ask, chiropractors who messenger us or Skype with us and ask us questions. We both have mentors who we ask questions, because we're continually learning as well. So if we finish up now with any questions that people might have, we can go through anything else briefly. Yeah. Does anyone have any questions?
Yes.
At what point do you transition from applying just a light pressure, where you're actually applying a thrust and getting a cavitation? Like at what point, at what age does that change, or does that transition happen?
The body is very self-correcting. Every time you lift an infant up, they might have a little cavitation happen, and that's normal. Some infants, when I'm, just joint play, will create a cavitation. So it's sort of not, less force is best.
Every case is unique. For instance, I would be thinking about, okay, what has gone on for this baby or this child today? How severe was the birth trauma, or what's their clinical picture? But also, what have the parents been doing? Have you talked to them if it's a newborn baby who's had some kind of issues about the importance of tummy time? Things like that, tips that I go through in Ticklish that empower parents about what they can be doing. Because, you know, it's our experience that a lot of those lighter techniques with newborn babies and young babies work incredibly well, but there may be a situation where you need to use something, you know, more forceful. But as children get older, you know, and they're having lots of knocks and falls and those things, potentially you look at the clinical scenario again and then determine, you know, which would be the right technique. But in answer to that, you know, there's wonderful post-grad seminars that you could do that would, you know, give you a whole range of templates. We also go through it on the app.